Perfect. Thank you everyone for joining today. And thank you for having me as well. I'm looking forward to discuss how SwoopAero integrate drone logistics platform and how the platform essentially empowers more robust supply chains and creates a positive impact in the communities we serve. So I'm joining you today from essentially from Melbourne and Australia. So before I jump in, I'll provide a brief introduction to myself and SwoopAero, and after that I will go further into the Swoop experience and our impact and the capability of the technology. The capability of the technology essentially to increase the strengths and agility of the health supply chain in public settings. So my name is Sabrina Ravail. I'm the Chief Commercial Officer at Swoop, and I lead the that's done. I lead the commercial strategy, oversee its implementation, and work closely with stakeholders to generate impact and growth. Prior to joining Swoop, I worked over a decade in commercial roles at multinational companies, and those included Revlon and Porsche Design. And I also started a successful NGO supporting integration of refugees in Germany. And the impact we are creating here at Swoop is what drew me initially to join the organization in 2019. A little bit more about Swoop. So Swoop was founded in 2017 by former Air Force pilot Eric Peck and robotics engineer Josh Tepper. And the company was founded on the back of a question asked by the Australian government as to whether a drone could transport chemotherapy into chemotherapy medication into rural areas in Australia. And the answer at that point was yes. But we essentially found a real question to be, what did a system look like that could do that sustainably, reliably, and safely every day of the week? Most startups essentially seem to try and look at a hobby drone and turn it into a delivery drone. And we basically took the opposite approach, and we took a proven manned aviation technology and scaled it down. So we leveraged the founder's experience and transformed a 70-ton Hercules aircraft into a 20-kilo 3D printed electric autonomous drone. So our mission as a company is to provide the world's leading technology platform for sustainable, reliable, and scalable drone logistics. And our goal is to provide 100 million people with access to sustainable drone networks by 2025. So what does that mean in practice? We essentially integrate drone logistics into the first and the last mile of the supply chain to transform its strengths and agility. And where we don't deliver that service ourselves, we provide our technology selectively to organizations across the globe to further reach our impact and our impact goal. Around the world, we're trusted by the biggest names in global healthcare. Those include UNICEF, USAID, UK8, to deliver routine and emergency health supplies to places such as Malawi, Congo, Vanuatu, and most recently as well Australia. And that basically keeps us on track of reaching our impact goal. And with every day of flight across the world, we continue to deliver on that vision, which is on our vision, which is for a world where seamless supply chains bring emotional and economic prosperity to all they serve. Where do I get to the next slide? Just here, perfect. So you might be asking, why are we using drones to deliver that vision? So the first element is that we operate, as I was saying, at the first and the last mile of the supply chain. And that part of the supply chain is complex and challenging one to bridge. And on top of that, geographical and climate-related factors are further increasing that challenge and are expected to increase when it comes to the climate-related ones, expected to increase in frequency and severity as well over the coming decades. And so we have found that drones, and more broadly innovation, is central to overcome these challenges. In fact, in rural and remote communities, one of the primary hurdles in the health supply chain in accessing health commodities are expansive distances, the terrain, so rivers, mountains, or the lack of infrastructure. And bidirectional drone deliveries can solve that. So the drones are VTOL drones, allowing for that dual approach rather than solely a delivery. Similarly, so we spoke about remote and rural settings. Similarly, if we look at urban settings, these drone networks augment existing services, which allow to balance a scheduled service with a cost-effective on-demand capability. They overcome crowded roads, they overcome a peak hour, etc. One example, one simple example that applies to both settings, so the remote and rural one and the urban one, is the one of telehealth, where a complete bidirectional drone logistics platform can basically be integrated into existing telehealth services and logistics systems. And what that does, it basically reduces the time lag between the delivery of the telehealth visit and the delivery of the medical supply. It also reduces, for example, fuel consumption, emissions used during transport. And just in a previous presentation, we were touching on SDGs, and that obviously has an important, or plays an important part as well, working towards those lower emissions. And when we speak about expenditures needed to acquire and operate fleets of vehicles, are reduced as well by including drone logistics into that system. Coming back to the 3 points, so speed, reach, and agility. Using drones essentially provides a speed advantage for the health system. So speed allows to cover distances faster, more quickly, and create the impact at the point of need with minimal delay. It also enables instant or almost instant logistics for the end user. So if we compare some of the countries that we're operating in, we'll basically be reducing a 90-minute journey to a 9-minute journey, or an 8-hour travel by road, boat, to a 30-minute one, which is almost instant as a result, and in those settings can be the difference between life and death. Speed, the second one, sorry, it's the reach. So on the reach, drones can also increase that. And so basically they increase the reach, that's a bit of a tongue twister, of fixed infrastructure. So when we speak about fixed infrastructure, that is, for example, of a health distribution center. And reach here is the ability for the ability to have a greater impact of that health distribution center within a defined area. So that the health center can deliver over longer distances with drones than it could with traditional approaches such as boats, cars, or motorbikes. So we've got the speed side, the reach side. In combining both speed and reach, we can, it basically means that the impact potential of a select distribution center or health center is multiplied by offering outcomes for more people, more times per hour, more times per day. And finally, the use of drone logistics also offers agility. Agility for us is the ability of the drone to switch tasks and meet changing requirements of the environment, but can also simply mean responding rapidly in the event of outbreaks, pandemics, and natural disasters. If we think about the 3 previous points, reach, speed, and agility, in realizing those benefits, the platform, realizing those benefits by deploying a complete drone logistics platform into a supply chain is kind of like the core element of what we do at Swoop. And with experience in deploying air logistics in a number of countries, 7 countries, we are leading the way in that industry. For us, the current pandemic has, actually not for us, but for everyone, the current pandemic has only served to highlight that finding solutions to existing health inequalities is a must, is a necessity today. And what we've found is that the realization has prompted governments, communities, and businesses to think much more holistically than they have before about health and well-being. And it is also remaining a key priority, should remain a key priority when it comes to national planning and community development. And during the pandemic, Swoop has also demonstrated that the speed, agility, and reach of drones are essential to support national governments when it comes to mitigating the impact of the pandemic. To give an example, across Africa to date, we have delivered over 40,000 medical products across Africa, with a figure that is rising daily. And this is an impact that where we basically support and create resilience within the supply chain. Going further into our operations and our impact to date, so we have a global footprint with a significant presence growing in Africa, with operations in Malawi, DR Congo, and Mozambique. On the next slide, if I can get to it, yes. You can basically see here that we're operating across high, middle, and low-income settings, and that is because a lot of those health systems face challenges, and they manifest very differently between Melbourne and Malawi, but the underlying causes are the same, as that in that the current medical logistics model doesn't cater for everyone and doesn't allow and always support the equitable provision of healthcare. I'll now dig deeper into two of our flagship stores, which is Malawi and DR Congo. So if we start with Malawi, we started in 2019 and commenced operation in northern Malawi in partnership with USAID under the Global Health Supply Chain Program to improve access to HIV and AIDS testing and antiretroviral medication, as well as other sexual reproductive medical supplies. So it was in 2019, and then in January 2020, we expanded into southern Malawi in partnership with UKAID and UNICEF. And here we basically integrated a multi-purpose sustained drone network that was capable both of delivering routine and on-demand healthcare, as well as basically capture high-resolution aerial images to create flood mapping models, disaster preparedness plans, and vulnerability maps. We have continued to operate that same network at scale since February 2020. And over the next 15 months, we will be working closely with our NGO partner, Bloodreach, to scale up that service to a national network to service over 150 health facilities across Malawi, and basically bridge the gap for those hard to reach and last mile communities. That should be an image of Malawi, but that is DR Congo. So I'll just stay on that slide for now. So in Malawi, essentially, we've showcased, or Malawi is a very good example of a country where we've basically shown the resilience of our air logistics platform. As we're all aware, the pandemic exposed a lot of challenges in the pandemic, especially for international businesses. Also, I should probably say, particularly for Australian businesses. In the environment, we basically had to repatriate a lot of the Australian team members because we were basically forced to return home, and our crew members in Malawi took over coordination, management, and operation of daily activities, so that the network could continue to operate as normal, with piloting done back from here. And that meant that SwoopAero became the first organization to remotely pilot from outside of its country of operation. So we basically had the pilot sitting in Malawi and the team in Africa, Malawi, we have since moved to have pilots in Malawi. We just had to leave very quickly during the pandemic and didn't have the time to finalize the training on that side. That being said, the local team has been integral to our impact-driven operations and around the world, not just Malawi. And it's a core pillar of our sustainability. And will continue to be part of it as we scale up to a national level over the coming months. It is also core to us to continue upskilling local team members and ensure that they can operate the technology independently of Australian team members or international team members. In countries such as Malawi or DR Congo, sustaining operations has been crucial in dealing with the COVID-19 pandemic and what came after, and more broadly as well, tackle preventable and communicable diseases such as rabies, malaria, TB. How do I get to the next one? Where am I? That, by the way, is our DR Congo, our Malawi team, and that is that's in DR Congo. And so, diving into our experience in DR Congo, we basically began setting up operations in DR Congo in 2019, following a global tender process with Village Reach, and returned to the country in December 2020 to expand the network. And today it has become the largest two-way drone logistics network, covering 22,000 square kilometers in remote areas in Equator Province. Our partner has funding from global health heavyweights such as the Bill and Melinda Gates Foundation and Gavi, the Vaccine Alliance. And as part of these phase 2 operations, we're routinely servicing 38 health facilities directly via 22 drone landing sites. And together with Village Reach, which is very exciting, we are conducting one of the first global impact evaluation reports for bidirectional medical drone logistics operations, because that is still a big gap in the industry. One of the key focuses in DR Congo is the routine supply of basic childhood immunizations. And I'm also just looking at the clock. I should probably either speak faster or just jump forward. So one of the key focuses in DR Congo is childhood immunization. But on top of that, we've also been delivering a lot of additional medical supplies as the need arose, such as HIV, multi-drug resistant TB, COVID-19, obviously, yellow fever, Ebola, polio lab samples, returning results, etc. I'll share a few milestones, particularly for DR Congo, that will cast a light on the impact that we're having there. So since December, we've flown about 94,000 kilometers. We've conducted over 2,200 operational flights, transported over 125,000 vaccine doses, and ensured that 27,000 people aged between 1 and 60 were vaccinated against yellow fever, and provided vaccines for more than 9,000 pregnant women. And that's only a few numbers. And so more broadly, on an international level, I think our impact speaks for itself. We've conducted over 10,000 operational flights. More than 2 million people are served by the networks. Critical journey times have largely been reduced. And on average, we have 4 emergency flights per week. And those emergency flights are the ones where you saw the example earlier was rabies vaccine or rabies medication delivered at a last minute. I might just jump very quickly over that. So we've also expanded our reach. So our reach is pretty diverse across high, middle, and low middle income countries. Anyway, and that is because essentially in LMICs and high income countries, that's what I want to say. That is because these health systems face challenges that might be different, as we said before, but it doesn't mean that they don't exist in high income countries. So in January 2021, we've launched our first platform customer, with skyports in Scotland to facilitate the collection of COVID-19 samples in Scotland, in the Highlands. And after success in that area, we're basically expanding that partnership across the Americas and Europe. The partnership in skyports in the UK was the NHS as part of their COVID-19 response. I'll continue jumping forward because I see the time running. Some of the key challenges, as I noted earlier, are so on the health side, they're all universally complex challenges. But the same is also true for implementing an innovation. So some of those challenges include technology maturity. I think they're all kind of like different maturity levels and understanding levels, regulatory maturity, and supply chain interoperability. And all those challenges have one common theme, is that the industry remains at its relative infancy, at least on the civilian side. And at Swoop, we are aiming at pioneering the way forward in terms of drone logistics integration, and work hand in hand with regulatory authorities and governments to support the development of aviation best practices. And that also leads me, and I'll probably stop there, to having launched in August this year our most advanced aircraft, which is the Kite, which will provide, which basically flies faster, further, and is basically further improving our technology, our full technology stack. But more broadly, if we think in the realm of global health, the Kite will basically further help us unlock new opportunities to support capacity building and resilience within health supply chains. Will allow to cover greater distances, transport larger payloads, and will basically enable Swoop to serve remote and hard-to-reach communities in some of the most austere geographical contexts. If as a closing remark, I'll just jump over these ones. But just as a closing remark, the SwoopAero solution, I think what we've tried to cover is that remains both agile in terms of kind of like design and applicability to optimize the health outcomes for communities. And the global pandemic has only served to highlight that finding solutions to health inequalities and those rising health inequalities is a necessity. And that realization has prompted governments, communities, and businesses to work more closely together and make health a greater priority. And I'm looking forward to being part of the technology transformation and a technology-based solution, and having Swoop as part of that in the next years, as it becomes very hard to imagine a future where air transport isn't a critical part of the health supply chain and the health logistic infrastructure. And I realize that I'm 2 minutes over. I'll try to speed towards the end. So if you do have any questions, I'm happy to take them.
Thank you so much, Sabrina, for your presentation. As always, Swoop continues to swoop us with your inspiring work. And I think you're all over the globe now. Congratulations for that. So, Sabrina, what is the secret behind Swoop's success? Is it technology? Is it people? Is it partners? What is it?
I think you've summarized it in a fantastic way. I think the people are at the center of everything we do. So we have a team of absolutely amazing and fantastic individuals who are very inspired to come to work and bring their best self to us every day. So I'm looking around, we're always open to welcoming new and inspiring partners and team members. So feel free to reach out on that note. So first, the team. But behind that, it's what is driving us as well, which is changing and driving that impact. But at the center of everything, we do have the technology. So the aircraft is only one element, and that's the visible element of everything we do. But there's a lot more than the aircraft. It's basically a full infrastructure, full system with software supporting the full integration into drone logistics network. And then obviously as well, partners. We do have fantastic partners, some of which I've spoken as well and are speaking throughout this conference in Village Reach, has become over the last few years a trusted advisor and partner in deploying and understanding global health supply chain challenges.
We have a question for you. How do you get BVLOS approvals, and how does it differ from country to country?
That's an excellent question. So the BVLOS approvals are something that where we basically work very closely with aviation regulators across countries. And so we have a strong aviation heritage. And so rather than thinking about regulations in an aftermath, the whole way that operations are set up and that we enter into different countries has the regulatory side at the center, because it's all well and good to have a use case, to want to deliver medical supplies and to want to solve the challenge. It's all about ensuring that manned and unmanned aviation integrate in a safe way. And for that, we ensure that we work closely with regulators, with other aviation providers. The secret about all of that is the aviation heritage, and also a fantastic director of regulatory strategy who works and has a background in prominent or at Qantas and a number of other airlines.
Thanks, Sabrina. We have a hand raised from David. David, would you like to unmute?
Thanks, Dr. Ricci. Thanks, Sabrina, for your presentation, noting that it's after midnight there in Melbourne. Good on you for doing the hard yards so late. I'm from African Drone Forum and do a lot of volunteer work across drone use, especially in Africa, and I've been watching SwoopAero for quite some time, particularly the operations in Malawi. My background's air traffic management, and I also asked Aerometrics this morning about this, or today, the same question, and that is, as more and more aircraft or drones come into the airspace, the UAS traffic management side of things becomes complex, especially in areas that are remote and have limited resource settings, particularly with connectivity, surveillance, and data mapping. So does SwoopAero see a future where they might use larger drones to fly and drop at more locations to reduce the number of aircraft in the sky? Or do you think that the project you've got with the kite is perhaps the way forward for you for the moment? Thank you.
Thank you, David. I think there are two aspects to that. The first one is the integration with other airspace users. And for that, we are working very closely with civil aviation, and we are also always looking at the best ways to communicate with air traffic. But more broadly, we do interface with UT, like with on the UTM side. Although that being said, also I'll stop because I'll start saying things that aren't entirely true, and I'm basically just reassessing what I hear from us. But that's the first element. So the first one is we do foresee a future where there will be hundreds of drones, hundreds of airspace users using it simultaneously. And for that, we are preparing the way that we're integrating with services such as I've got a blank moment, but essentially other UTM providers. On the other side, integrating with larger aircraft does not only serve to reduce the amount of aircraft in the air, it will also help link networks between each other. So if we, for example, take the example of Malawi or of DR Congo, if we do have several hub and spokes model, we can link those networks between each other and link those supply chains in a different way, allowing us to supply, for example, medical supplies to those kind of like larger areas at at regular intervals, but also just cover greater distances without the need for hub and spokes model if there isn't for changing pod locations and if there is a need for it, for example. Does that respond to the question?
Yeah, that's really good feedback. Thanks so very much.
Thank you, David.
Thank you so much, Sabrina. I think we will move you to the chat. So any comments, any questions for Sabrina, you can put it in the chat. And Sabrina, thank you so much for being a part of our conference. I really look forward to having many more interactions with you. And we also look forward to learning from all the case studies that you have put up, all the experiences that you have put up. And hopefully we will have SwoopAero in our countries very soon. Thank you so much, Sabrina.
Thank you so much, Dr. Rushi, and likewise, I'm looking forward to discussion with you. Have a good evening.
Good evening, good night, Sabrina.